Spinal surgery, it's often the last resort for that really debilitating back pain. But what happens when the surgery is over and the pain isn't? Well, today we're going to demystify persistent spinal pain syndrome. We'll break down why it happens and what the latest science says we can actually do about it.
And that's the question, right? Why does my back still hurt? It can be so incredibly disheartening. You've gone through this major procedure, you are hoping for relief, and then you find the pain is still hanging around. Or, hey, maybe it's even a totally new kind of pain. If any of this sounds like you, the most important thing to know is you are definitely not alone. In fact, studies show that a surprisingly big chunk of people, somewhere between 10 and 40% of patients, experience this. That is a huge number, and it really just goes to show how complex both the spine and chronic pain really are.
Okay, so to really get a handle on this condition, we first have to talk about what we call it. And the language we use to talk about pain is actually super important because it really shapes how we think about treating it.
For a long time, this was called failed back surgery syndrome. But just think about that name for a second. It's totally loaded with blame. It makes it sound like the surgeon failed, or that you, the patient, failed. So now the medical community is moving to a much better, more accurate term: persistent spinal pain syndrome type 2. See, this isn't about failure. It's a clinical diagnosis.
So what does that big clinical term actually mean? Well, to put it simply, PSPS type 2 is any chronic pain, either in the back itself, which is what axial means, or shooting down your limbs, that either just continues or maybe even starts after you've had spinal surgery. It just gives us a clear, straightforward name for a really complex problem.
And that, of course, brings us to the most important question of all. Why does this happen? Well, the answer isn't just one thing, which is why a really careful and thorough investigation by your doctor is always the first critical step.
So before a doctor can even land on a diagnosis of PSPS type 2, they kind of have to play detective and rule other things out. This means a deep dive into your history, a physical exam, and usually some imaging. The main goal here is just to make sure there isn't some other serious, urgent problem that's causing the pain.
And what they're looking for, first and foremost, are what we call red flags. These are the really serious conditions like an infection, maybe a new fracture, a tumor, or any kind of worsening neurological issue that would need immediate attention.
Okay, so once those big, scary red flags are ruled out, the list of potential causes for the pain is, it's incredibly varied. It could be something like the first surgery just wasn't the right one for that specific type of pain, or it could be a technical thing, like a tiny disc fragment got left behind. It could even be biomechanical changes, where the parts of the spine next to the surgery start to wear out. Or it could be complications like epidural fibrosis, which is really just a fancy term for a buildup of scar tissue around the nerves. With a better understanding of what might be going on, we can start to talk about treatment. And honestly, the best way to think about the approach here is like a ladder. You start on the bottom rung with the simplest options, and you only climb up if you need to. But first, we gotta set some realistic expectations. The research is very clear that managing this condition is a real challenge. I mean, look at this quote from a clinical review. It says it's often refractory, which is just a medical way of saying it's really stubborn and resistant to standard medications. And that is exactly why this multi-step approach is so important. And this right here is a perfect visual of that treatment ladder. Step 1, the bottom rung, is always conservative care. We're talking physical therapy, targeted rehab. If that doesn't get you enough relief, you climb to step 2, which is medications. From there, you can move up to step 3, interventional procedures. And way up at the top is step 4, advanced therapies like neuromodulation, which is a big term for using technology to actually change how your nervous system is sending pain signals. Now here's the tough reality for a lot of folks with PSPS type 2. The evidence for those first couple of steps, conservative care and meds, is often kinda limited. It's not that they can't work, but they often don't provide enough relief, and that's why so many people progress up the ladder to explore these more minimally invasive interventional options. And there are some really targeted procedures out there that can help. Things like pulsed radiofrequency, which uses these little energy waves to calm down irritated nerves. There are also procedures like adhesiolysis and spinal endoscopy, which are designed to go in with these tiny instruments and literally break up that painful scar tissue that might be pinching or trapping your nerves. And that brings us all the way to the top of our treatment ladder, to a technology that has really become a cornerstone for treating this type of persistent, nerve-related pain: spinal cord stimulation. So what is spinal cord stimulation, or SCS? Well, basically, it's an implantable device. The easiest way to think about it is like a pacemaker, but for pain.
It works by placing these really thin, flexible wires, called leads, in the space right near your spinal cord. And these leads deliver these tiny, mild electrical pulses that essentially intercept the pain signals that are trying to travel up to your brain.
The science behind it is actually based on a Nobel Prize-winning idea called the gate control theory of pain. The super simple version is this: your nerves can't really carry two signals at once, so the gentle stimulation from the SCS device kind of gets there first and closes the gate, which blocks the sharp pain signal from getting through to your brain. It's almost like you're turning down the volume knob on your pain.
And the evidence? Well, it's pretty compelling. A major study directly compared SCS to going back for another operation in patients just like this. And the results were just, wow. So 47% of the patients who got the SCS had significant lasting pain relief. In the group that had repeat surgery, only 12%. That's a nearly 4 times better success rate.
And look, this isn't some old, dusty technology. It has come such a long way. The first systems back in the 60s were pretty simple, but over the last 2 decades, we've just seen an explosion of innovation. We now have things like high-frequency and burst therapies that provide relief without that old tingling sensation, and the newest systems can even listen to your body's nerve signals and adjust the therapy automatically.
Okay, so we've looked at the problem, the causes, the treatments. What are the big takeaways here? What do you really need to remember as you navigate this journey? This right here, this quote is absolutely crucial. For an advanced therapy like SCS to work, careful patient selection is the single most important factor. It is not a magic bullet for all back pain, but for the right person with the right type of pain, it is a powerful, evidence-based treatment that can be truly life-changing. So let's just boil it all down. What's the bottom line? First, your pain is real, and it has a name: PSPS type 2. Second, finding the right path forward always starts with a thorough diagnosis to figure out the cause. Third, remember that treatment ladder? It's a structured, step-by-step process. And finally, while this journey is tough, advanced therapies like SCS offer real, evidence-based hope. Understanding all this makes you an empowered and informed partner in your own care.
And all of this, it leads to one final, really big question. With technology advancing so fast, from smarter, more personalized devices to just a deeper understanding of the neuroscience of pain itself, it really makes you wonder, what's the future of treating chronic pain going to look like in 5 or even 10 years? The good news is, the search for better answers is always moving forward. Thanks for joining us.